the 21st century, you probably know someone who has diabetes, whether that's friends, family, or maybe even yourself. The internet is full of opinions, hypotheses and myths about the condition, but joining us today to shine some light on the subject is endocrinologist Dr Katherine Benson from Sydney Adventist Hospital. Katherine, thank you so much for joining us.
Thank you, Marielle. Pleasure to be here.
No worries. My first question, so as I mentioned, you know, the internet is full of all kinds of myths and rumours and things, and one of them I think is that diabetes is on the rise and it's just increasing exponentially. Is that true, or are we just kind of more aware of it these days?
No, we're certainly facing an epidemic of diabetes, type 2 diabetes in the 21st century, and this really parallels the obesity epidemic that we've seen in recent decades. So we now estimate that 1 in 12 adults have diabetes.
1 in 12?
And 280 Australians will develop diabetes every day.
Wow.
So it is very common.
That's crazy.
What's the difference between diabetes type 1 and diabetes type 2?
So they're quite distinct disorders. Type 1 diabetes is an autoimmune disease. It often affects children or young adults, although it can occur later in life. And in type 1...
So they're born with it, or they're
born with the genetic predisposition, and then something, maybe a viral illness, can trigger it at any stage of life, but it commonly develops in children. It's not a lifestyle disease. It's not due to being overweight or not enough exercise. The immune system attacks the pancreas and destroys the insulin-producing cells. So young people with type 1 diabetes have a total deficiency of insulin and are dependent on insulin for life to keep them alive and healthy. And that's quite different to type 2, which more commonly develops later in life and is related to lifestyle factors such as unhealthy diet, being overweight, being too sedentary.
What about gestational diabetes then? Which one is it?
Gestational diabetes is another category, and that's becoming more common as well. It now affects about 12% of Australian women. And gestational diabetes develops in pregnancy because the placenta produces hormones which lead to insulin resistance. There are a number of risk factors for gestational diabetes, such as being overweight, being older, having a family history of diabetes. Certain ethnicities are more predisposed to gestational diabetes, and women who've had polycystic ovarian syndrome are also at higher risk.
Right.
I'm just curious about this whole gestational diabetes thing. Does it mean then that your baby actually has a predisposition towards type 1 or type 2?
Gestational diabetes does not increase the risk that baby will have type 1 diabetes.
Phew.
Which
don't need to worry about the sugar and salt anymore.
But there is an increased risk that the baby will have insulin resistance later in life. So it's important to focus on healthy lifestyle, regular exercise for the children as they grow up to reduce the risk of developing obesity and type 2 diabetes.
Do all pregnant women have to worry about it, or is it something the doctors will check for?
We now have routine screening in Australia with a 2-hour glucose tolerance test, and that's typically performed between 26 and 28 weeks of the pregnancy in all pregnant women, although if a woman is at higher risk, the glucose tolerance test would be performed at 16 weeks initially and then perhaps repeated later on.
Is that a similar test to pre-diabetes? I was a little bit confused. What is pre-diabetes? Because I never heard of that before.
We define pre-diabetes as a fasting glucose level between 6 and 7 millimoles per litre. And type
that's
2,
their sugar reading.
That's on a fasting blood glucose test.
Right, right.
And type 2 diabetes is defined as a glucose above 7. So it's,
yeah. What's the average of like the resting glucose level in the blood?
What should it be?
What should it be? Sorry, yeah.
Well, between 4 and 8.
4, okay.
But in terms of making a diagnosis, we do it with a fasting glucose test.
Yeah, that makes sense. One rumour I've heard is that feeding your children cow's milk when they're young increases their predisposition to type 1 diabetes. Is that true?
There's a little bit of emerging evidence that cow's milk exposure could be a factor, although research is continuing. There are big studies that are underway. For the time being, you know, best practice is to advocate breastfeeding for at least 6 months wherever possible.
Right, yeah. Also, I hear that is there no cure for diabetes? Or is there?
Yeah, that's a good one. Like, can you reverse it?
Yeah, exactly, yeah.
Yeah, so we just need to talk about the two different types. So for type 1 diabetes, which we spoke about as an autoimmune disease, there's currently no cure, and people with type 1 diabetes are dependent on insulin for life to keep them alive. Type 2 diabetes, which is related to lifestyle factors, can potentially be cured with lifestyle change, and there's been some exciting research in that regard published in the last 12 to 18 months.
Just by changing your diet or becoming more active?
That's right.
Yep.
So in people with pre-diabetes, we know that lifestyle change leading to 4 to 5 kilograms weight loss will reduce the risk of developing diabetes by approximately 60%. So it's good to get in early at that pre-diabetic stage with lifestyle change to try to prevent the development of diabetes. For people with established diabetes, particularly if it's of recent onset, then lifestyle change and in particular weight loss of 5 to 10% can potentially reverse the process.
That's like 4 to 5 kilograms, 5 to 10 kilograms. That's a lot more manageable, I'm sure, than diabetes.
So we're
is.
talking fairly modest weight loss can pay
Yeah.
huge metabolic dividends.
And is it just weight loss when we talk about lifestyle factors, or is it sort of getting outside more, getting fresh air, you know, eating only vegetables? Is that the primary lifestyle change, just the weight loss, or are there other factors that we should also, or are they kind of hand in hand? I don't know.
Yeah, at the end of the day, I think getting weight into the healthy weight range is the most important factor. And there are numerous dietary approaches, as we all know, and that's quite a controversial big topic to discuss. But I think if you can eliminate those sugary drinks, lollies, cakes, biscuits, try to have plenty of vegetables, legumes, those healthy foods in the diet, and keep the treats to an occasional thing, then that's going to be helpful.
If you have diabetes when you're pregnant, what are the chances of getting it later in life?
So we estimate a 50%, so 1 in 2 risk of developing diabetes over the next decade.
That's one of us, Mel.
Oh,
We both had gestational diabetes,
but
so one of us.
diet and exercise can
We can
reduce
reverse
the
it.
risk. Yes.
So that's type 2 diabetes.
Yes, so if you've had gestational diabetes, there's a 50% chance of developing type 2 diabetes over the next decade, but you can reduce the risk very significantly with lifestyle modification.
Good to know.
I didn't have diabetes when I was pregnant, but my father got type 2 diabetes as an older man in his late 70s. Does that mean I'm more likely to get it at that age as well?
It does increase the risk. So the genetics for type 2 diabetes are quite strong. So family history is something that's relevant.
You know, I read some research about vitamin D. If you're low on vitamin D, there's a link to diabetes. Is that true? Because I actually had to take vitamin D tablets while I was pregnant as well. So, and I had gestational diabetes. So is there a correlation to that, or?
Vitamin D, it's an interesting story. There have been links with a number of autoimmune conditions. The initial link was with vitamin D deficiency and multiple sclerosis, and that led to research into that field. There is some evidence that vitamin D deficiency can worsen insulin resistance. So,
Should you take vitamin D tablets?
if you're getting adequate sun exposure, then there's no need to take vitamin D tablets, but a lot of older Australians are vitamin D deficient. As we get older, our skin's less efficient at producing vitamin D, and supplements may be necessary. As we talked about in previous segments, vitamin D is very important for bone health and calcium absorption, but there may be some added benefits with respect to insulin resistance.
Right.
So if there was one short message, we're almost out of time, that you wanted to communicate to the public about diabetes, what would it be?
That diabetes prevention is really worthwhile, and that lifestyle change leading to modest weight loss of 4 to 5 kilograms can halve your risk of diabetes.
Empowering stuff. Thank you so much for joining us, Katherine. We really appreciate it.
Okay, thank you.
No worries. Until next time, goodbye and God bless.